Have you ever wondered how doctors can get a look deep inside the human body without making a single major cut? Well, today we're taking a journey. We're heading into the upper gastrointestinal tract to see how one incredible tool solves some of medicine's biggest mysteries. Okay, let's dive in. You know, your body is always talking to you. That nagging pain, a sudden change you can't explain, these are all signals, they're clues. But when those clues point to something going on deep inside your digestive system, how do doctors crack the code? How do they read those signals before it's too late? Turns out they have a tool that's kind of like a detective's magnifying glass. And this is it, the upper GI endoscopy, or what doctors usually call a UGI. So what is it? Think of it like a long, super flexible tube with a tiny, high-definition camera on the very end. This lets doctors get a direct, real-time look at your esophagus, your stomach, and the very first part of your small intestine. It's their #1 tool for investigating what's wrong, and sometimes they can even fix the problem right then and there. So, when does a doctor decide, okay, it's time to send in the camera? Let's open up a few case files to see exactly when a UGI becomes the most important next step. Okay, our first case, it involves some pretty common complaints, but there's one really concerning twist. This is the kind of scenario that puts doctors on immediate high alert.
So we have a 50-year-old woman. She's been dealing with heartburn and some discomfort right in her upper belly. Now, by themselves, those symptoms might not be super unusual, but she also has recent unexplained weight loss. And that, my friends, is what we call a red flag sign. It's a serious warning that something more serious could be going on, like an underlying malignancy.
With a red flag like that waving, there is absolutely no time to waste. The verdict is clear. A diagnostic UGI is needed, and it's needed now. It's really the only way to get eyes directly on the tissue and see what's actually causing these symptoms. Next up, a patient whose symptoms are pointing to a problem that's totally hidden, but it's leaving a very, very distinct trail of evidence. All right, here we have a 45-year-old woman. She's feeling weak, tired, all the classic signs of being anemic. But here's the key clue. She reports having tarry black stools. Now, I know that sounds a little gross, but in medicine, that's a huge clue. It's a telltale sign of bleeding somewhere in the upper GI tract, because when blood gets digested, it turns black. Add to that, she's on NSAIDs, common stuff like ibuprofen, which can irritate the stomach lining, and a bleeding ulcer becomes suspect #1. So the mission is simple. Find the source of the bleeding. A UGI is the perfect tool for this. It lets doctors go right to the duodenum, which is just past the stomach, and see with their own eyes if a bleeding ulcer is the culprit. Now, for a real head scratcher, this next case seems to point in one direction, but a good medical detective knows that clues can sometimes be pretty misleading. Okay, so a patient comes in with massive bleeding from the rectum. Now, logically, you'd think the problem is in the lower GI tract, like the colon, right? Well, not so fast. Here's the wild part. If you have a really severe, really fast bleed from your stomach or duodenum, that blood can move through your system so quickly that it doesn't have time to get digested and turn black. So it comes out as red blood, making it look exactly like a lower GI bleed. And because of that, standard procedure is to perform an upper GI endoscopy as one of the very first investigations. Before you even think about looking at the colon, you have to rule out a life-threatening bleed from up top. It just goes to show how versatile and crucial this procedure really is. So we figured out when a UGI is the right call. Now let's get to the good stuff. What does that camera actually find? What does the evidence look like up close? That little camera can uncover a whole range of things. Of course, it can spot an active problem, like a bleeding duodenal ulcer, but it can also identify long-term risks, like Barrett's esophagus. That's a condition where the normal cells lining your esophagus get replaced by a different type, a type that can sometimes lead to cancer. It can even find these swollen, bulging veins called esophageal varices. And get this, doctors can often treat them right then and there with tiny bands, preventing a catastrophic bleed. It's pretty amazing. But look, even the best detective in the world knows you can't solve every single case with just one tool. UGI is incredibly powerful, for sure, but it's not always the best first choice. This is so important. It's all about choosing the right tool for the job. For something like simple acid reflux or GERD, an endoscopy might actually look perfectly normal. The real gold standard there is 24-hour pH monitoring, which actually measures acid levels over time. And if you want to see how well the esophagus is squeezing and moving food down, well, a barium swallow gives you a much better picture of that function. See the difference? The endoscopy sees the anatomy, what it looks like, but these other tests measure the function, how it works. So after this deep dive into the world of upper GI endoscopies, what are the most important clues we've uncovered? Let's summarize the case. Let's wrap this up. Here's what you really need to remember. First, the UGI is the #1 detective for those red flag symptoms, like unexplained weight loss. Second, it's brilliant at finding hidden bleeds, even when the evidence shows up in some really unexpected ways. Third, its real power is in direct visualization. It lets doctors see the clues, from ulcers to precancerous changes, with their own eyes. And finally, don't forget, it's a specialized tool. For issues like simple reflux or motility problems, other tests are the true gold standard. The endoscope completely opened up a new frontier in medicine, right? It allowed us to see what was once totally invisible. It really makes you wonder, as our technology gets even smaller, even smarter, and more powerful, what new mysteries, hidden deep inside our own bodies, will we finally be able to solve next?